so we're not going to delay anything. We're going to get right into the meat of the meeting. Will the clerk please call the roll?
Good afternoon, everyone. All right, Commissioner Miller,
Here.
Commissioner Overman, Commissioner Merman,
Here.
Sheriff Cronister,
Here.
Mayor Castor,
Here.
is it Vice Mayor Chalura?
Vice Mayor Andy Ross, here.
Okay. Mayor Lott
Here.
and Ms. Snively.
Vice Chair Steve Kona, here.
All right, thank you.
I am glad to see everyone here, and everyone passed the test when they came in. I see with your green badges around your neck, so good to hear that. I'm going to turn it over to Mr. Merrill, who will make some comments, and then we'll turn it back over to me. Mr. Merrill.
Thank you, Mr. Chair. So you're going to be hearing a lot of information this morning. It's all good information, it's all helpful information, but I wanted to take just a moment to try and give it to you in very short bits here so that I can tell you what the important stuff is, and then you'll hear more details. And then I want to make 3 proposals for the EPG to consider. So first of all, we do continue to work closely with all our partners in the community in order to meet what is a rapidly changing need out there in a rapidly changing environment. We're focusing our efforts on bringing resources to those who are the most vulnerable, seniors as well as small businesses. You're going to hear that we, together with our partners, have really been focusing on providing and preparing for what we believe will be a very large need from folks who may be losing their jobs, who may have other resource needs, food, rent, and so forth, so that we can take on that larger volume of folks that we plan on seeing, and we do have a system that's set up to handle that. Our economic development folks, working with our partners, are actively engaged with our small business and our business community and with CareerSource in order to help quickly implement the availability of small business loans and to get people who need work to the right place so that they can hopefully not experience too long a time period without work. You're going to be hearing from Brandon Waggoner, who is my legislative and operations officer, on where things stand at the federal and state level with legislation. You're going to hear about closures and restrictions, and I'll be addressing that in a minute. The one thing you are going to be hearing about that everyone is asking, most asks about, is the testing and collection. So very briefly, where we stand is that Raymond James Stadium and the fairgrounds are the first 2 facilities. Raymond James will go first, followed by the fairgrounds. We are still, as everyone is, constrained by the availability of collection and testing kits. We did not want to open drive-through facilities and not be able to provide the service. So we're going to start with Raymond James first and then move to the fairgrounds. One bit of good news is that I believe it was Florida Department of Health has now allowed the standard influenza testing kits to be used where appropriate to supplement the specialized COVID-19 testing kits. So that should help bring more supply into the marketplace. However, there still is a large shortage of personal protection equipment for those healthcare providers who are actually taking the sample, and we really need to conserve the supply of protective gear that our first responders have because they need it as well. So I want everybody to understand, it's not because we've been slow, it's not because we don't know what we're doing, it's because we can't open drive-through facilities without having the ability to take the samples and have a reliable system to track them. The sites are ready with all of the other logistics, and as more testing equipment is available, will open more facilities. You're going to hear from Dr. Holt about alternate care sites that are being, in the process of being set up in the event that we should need that as a relief valve for hospitals and others, for patients who need to be kept apart from the rest of the hospital population. So before we launch into the presentations, there's three things that I would like to offer to the, or recommend really to the EPG to consider later when you take up actions. First of all, I would propose that we go to a 9 p.m. to 5 a.m. curfew that would be enforced by sheriff and police departments. I think that will go a long way in helping to keep the social interaction to a minimum. That, of course, would exempt people who work during that curfew period. Sheriff, and I'm sure all of the police, law enforcement agencies are used to dealing with that kind of thing. Second thing is, I believe from a restaurant point of view, a lot of restaurants are already going to takeout and delivery. I think the logical next step is to restrict all restaurant activity to delivery 24 hours, and then of course they would be exempted from the curfew. Finally, I would propose that we drop the 50-person limit for gatherings down to 10. The reason is this, that CDC guidelines say that there should be no more than 10 people in gatherings where there are high-risk individuals. That would be the elderly, those who have certain medical conditions. It's almost impossible to be able to ferret out, you know, where that's going to happen. And so I think the best thing at this point would be to drop the number that we already have out there from 50 down to 10. So I'll leave that for the discussion of the EPG at the end. And if everybody's ready, we'll start with a presentation by Dr. Holt.
Dr. Holt? Good afternoon.
Thank you. Good afternoon. My name is Dr. Douglas Holt, Florida Department of Health, and I'm here to continue in my role to update and advise so that you can make some decisions on what needs to be done as we execute the pandemic response plan. Our goals remain the same. We want to limit the number of people who are ill or die. We want to continue our essential healthcare services, essential governmental service, and we want to minimize the disruptions of both social and economic. Everything we're doing is consistent with what the governor is saying. 67 health departments are all aligned, led by State Surgeon General Dr. Rivkees. Without the contributions of our local government, medical community, private sector, and the public, these are all critical and very much appreciated. I'd like to first start off with the actions you took last time, particularly as it relates to social distancing and you're talking about now. The whole design of that is to basically take the oxygen out of the fire so things calm down. Right now, we know COVID-19 has been in Hillsborough County for at least 3 weeks, probably longer. And despite our efforts at case containment to stamp it out, as I talked about almost 3 weeks ago, it continues to spread. After initially 2 weeks of no new cases, we've had 10 this following week, and we still know what needs to be done, what to do, and it's up to us to decide how to best do them. Our priorities and of our associated actions are personal responsibility to protect themselves and others. We're continuing to message to most of the public is doing so. We certainly see some that get a lot of attention that they're not complying. And I would speak to them that while people may think they have a low risk of dying, you can still get quite sick with this virus, no matter at what age. And there's a big difference between not evacuating during a hurricane where you assume the risk personally and then put others at risk. Social distancing, it has you going just to restaurants around the bars and others. Teleworking and education is prominent. I think the community is stepping up, not that prevent doing more. Our case containment and isolation of the public health is continuing. We must prevent outbreaks from our known cases. We currently have 19 cases. We are monitoring very closely up to 450 people that have a known exposure to those. So we've got essentially people on self-isolation or quarantine or will call us if they get sick. The health department is beginning to focus the resources on this population because we expect this only to grow as we see more and more testing. I really think protecting the vulnerable is most important right now. We're already seeing, if you look at the last week or two of our cases, initially they were 20s and 30-year-olds. We're starting to see older individuals, and that's not surprising. We're developing a capability that we can rapidly assess, test, and respond to a person in a nursing home or an ALF with an influenza-like illness, possible COVID-19, or worst case, already determined to be COVID-19. I've enlisted the help of Dr. Asa Oxner from USF Help and Dr. Margarita Cancio from Infectious Disease Associates Tampa Bay. They're developing medical protocols that we can share with our nursing homes and ALFs, and working with Chief Jones and Cicero, be prepared if first responders need to do what needs to be done. We must avoid what we saw in Kirkland. Working with the hospitals to ensure that there are safe and appropriate discharges of the patients that they're caring for. These are our most vulnerable. We must make sure that they are discharged to an appropriate place. All their home care is needed, their medicines, and in addition, regular monitoring through telehealth. Some of these patients are quite complex to try to take care of in the home. Dr. Sita Lakshmi and Andrew Myers from USF Tampa General are helping us develop those protocols to be shared with all the hospitals, along with Dr. Lindell Siglio at Baycare. I've had discussions with Mr. Merrill about options that could be needed if the hospitals are full and we need to find patients that don't reach that level of acuity, but they can't be managed at home. Where can they safely be placed and cared for? They're called alternate care facilities. Protecting the public, our healthcare facilities, and ramping up our telehealth and our outpatients. The barrier remains, as I'm discussing with providers, is some difficulty from reimbursement for the insured, and how do we do that for the uninsured. Finally, increase access to our testing. Locally, besides the state lab, we are blessed by having Tampa General Baycare and Advent Health all doing tests in our community. That gives us rapid results that is not available through the overwhelmed or the closely maxed out state labs. The local public-private partnerships that will be described fully and have been explored, I think we fully support them and want to do our part. Critical shortages. These are N95 masks. Of all of the protective equipment, these are the most short supply. Even if you just give to a provider, it also requires fit testing and some others, so it's not as simple as just putting it on. This is a gown, glove, and an eye shield in a packet. They're not as scarce as the N95, and there's things that the hospitals and others can do. These are the collection swabs. In addition to the swab, there's a tube that you have to put it in as a transport medium. These are in the most short supply that we have right now. We were able to get 120 from our commercial sites, suppliers, Quest, LabCorp. And that's mostly what we're doing at the health department to provide testing for those that we identify at highest risk and or for those for our contacts of our known cases. There are alternatives for this, workarounds. You can use some influenza swabs and some other transport, and I think increasingly that's the most immediate response to that shortage. I'll stop there and conclude my update and be welcome to answer any questions.
Are there any questions? Mayor Castor, you recognize.
Dr. Holt, so these the swabs for the flu, are those available?
Yes, they are widely available. Most offices can use those to test in their office a rapid test for influenza. I certainly can't estimate the exact quantity, but that is a standard of care for most clinicians, and so I can't give you the exact amount, but there is a lot more of those than what we have.
And then the vial that they put them in, it's the same transport, or is that separate?
No, they've proposing, and I'm becoming an expert, but all the way down to simple saline, which is like a salt water, and then there's some others. So increasingly the labs, the state has agreed, and I was told LabCorp and Quest, which are the bulk of the running the test, will also accept samples in that form instead of the commercial ones that that previously had been required.
Okay. Because that's, I mean, that is what's holding us up, or the collections. So we've got to get those. Now, just a couple questions, and I spoke with you before. Can you review the current criteria that you use at the health department for someone to get tested for COVID-19?
The criteria that we use includes basically those that are ill, starts with that, or they have a known contact exposed to an individual, and they have something in their history that includes travel, cruise ships, anything that would put them at an unusual type of recent experience. Mm-hmm. The state also has a category they call the expanded criteria. The state labs can't accept that samples with that indication just because of their limited ability to run the test, but the commercial labs will, and it boils down to a clinician can order it.
Right. But the problem is that individuals without health insurance they can't have their physician request this test. So would it be helpful if this board requested that the state relax those standards for the health departments?
Well, the standards would, no matter how much you relax the standards, you've got to find a way for people that are uninsured and or do not have a doctor to have access. The test really can't be run through the labs without an ordering physician, and then the results can't go back. So it's not just changing the criteria and expanding the access, it's having that piece. The Hillsborough County Healthcare Plan has done a marvelous job for helping to fill that gap for those, and we have some very strong providers. Certainly would want to work closely with them to make sure that there's equal access to all in our community for the testing.
So individuals without health insurance can't come to the health department without a provider that requests the test?
Let me call on Mr. Merrill to talk about that. Mr. Merrill?
We'll get some more detailed information, but the protocol that the 4 or 5 major healthcare providers now have agreed to is that we'll have a single call center number, which will be the county's call center, They will help staff that call center with RNs who will do the screening. So we'll publicize the number, physicians, whether they're in or out of a system, any healthcare facility will know to tell their patient or anybody who calls which number to call. When they call, the RN on the other end of the line will do the pre-screening to determine if, in fact, they need the test. They will then tell that patient where to go, which facility. That is the quickest way to get people through the gate. That in and of itself is, I would say limiting, but it's reducing the amount of steps that I think you're talking about. It reduces it down to a telephone encounter with a screening panel that then the judgment of the person on the phone, the RN, is yes, this person needs to go to Baycare, Raymond James, State Fair Park, whatever it is. They'll get a boarding pass, they go, they get tested. It's a drive-through.
Yeah, but I'm not talking about the steps to take the test. I'm talking about the requirement that we're still looking at travel as a requirement, and, you know, it's being rapidly spread throughout the community.
Yes, I mean, you're correct in that the travel is sort of the focus of things, but as they've expanded it for people who are over 65 and immunocompromised, that does expand within our criteria. The most important one that is available, but it is not, the lab can't be collected or run at the health department, are those that the doctor would like to order. What you're asking, if I understand it, ma'am, is that what if they don't have a doctor and we need to set that system up? An RN triage call can achieve that as long as they're linked to a referring or an ordering doctor, so the results do come back, because ultimately you want to get the results back to the individual.
Okay. All right.
Commissioner Overman, you're recognized.
Yes, thank you. Thank you, Chair. We talked about several things prior to that, but I'm going to address a lot of the medically related questions as you're on the point. Just to clarify for family members that may have patients currently in a hospital for unrelated coronavirus reasons, those patients may require rehabilitative care, may have to go to a rehab center, may need skilled nursing care. And while we may be setting up alternative sites for individuals that need to be isolated for suspected or test positive coronavirus, these individuals may have other issues. They may have just had a hip replacement or, or something that requires that they end up in a skilled nursing care or a nursing facility. What processes or assurances do you have for family members to confirm that those family members will not be sent to will be sent to a non-compromised facility, given that we heard earlier on the news today that there were 19 facilities that actually were compromised or had individuals that had tested positive for coronavirus?
Yeah, we're working with our nursing homes, ALFs. The only option we have right now, our toolkit, is to actively look out for anyone in that facility that becomes symptomatic. Then do what I was talking about, a very rapid assessment, in-house, a test that we would both rule out influenza and collect for COVID-19. My concept would be that instead of the state lab, which is slower, we would use one of our hospital partners to expedite the results. COVID-19 in nursing homes, at least the experience that we learned about from Washington, it gets in there through a variety of different portals, whether it's staff, patients, a family. So that's why the restrictions on who's can come in are basically prohibited, and similar to what we had to do to get into this building is part of the standard practice for even staff.
Okay, let me get more specific. I'm a discharge nurse, and I'm planning for a discharge of someone who needs to go to a rehab center. Is that discharge nurse aware of a facility that might compromise her patient for further care?
If there is a case of COVID-19 that we're either investigating or aware of, there would be no one that would be going into that facility. The question would be more, do I pull the infected person out and put them somewhere else, and then go systematically through all of the residences, the staff, to determine if any of them are also carrying the virus, and they would also have to be excluded from that facility.
Okay, so wouldn't it be more sense to make sure that the discharge nurse is aware that that facility may be compromised and try and find a different facility? If the hospital staff is aware
we would make them aware.
there's a compromised facility, they wouldn't go there.
Right.
Right, so is that information getting back to discharge personnel in our hospitals where rehab facilities would be the natural course of healthcare for that person, that they're given that information to avoid compromising a relatively healthy patient that just needs care?
In the event of that facility being compromised, absolutely.
Okay, so that information is being made available to the hospitals that are treating people for rehab.
We have a process to provide that information
Excellent.
when we get the information.
I just wanted, because we have had families, I've gotten messages from families that are going, wait, they're discharged into this facility. I don't know whether or not that's a great place for them to go. And I don't know that that's a great thing to do. Can I care for my family member when they really do need the care they need? So having those assurances helps people be compliant and be great family support systems for their family member that's coming out of a hospital.
Yeah, I think the steps that have been made by both the county and city to link up with the nursing homes and ALFs to ensure that they are practicing the restrictions on entry, looking at their needs from an infection prevention, how do they have enough hand sanitizers and other things. Y'all started that even before there was any, we anticipated that, and that's what we're trying to do is lean forward in this particular most vulnerable patients or people in a congregate setting.
Okay, great. And that has to do with a follow-up question that I have. We do, because we're always going to be behind the power curve to a certain extent, according to Dr. Farsi, that had talked to us about, plan for the head and find out where we are. And as we've seen numbers increase over time, we're going to see numbers increase over time because we have more testing. I mean, that's just normal. So I think it's important for us to communicate. We've got more testing, so we're going to have more cases.
Yes.
But that doesn't mean it's not out there. So all the things that we've told people to do to encourage, washing hands and keeping a distance becomes critically important. But it isn't always a second thought, just as you're in the grocery store. Are you staying 6 feet away from it? And are you helping that checkout person be safe too? When we see those numbers, we're going to see the need to self-isolate a lot more common rather than because I need to be tested. But do you have a recommendation for basic protocol for those that go into homes to visit people? For example, our DCF workers that are now not allowing people come to their facilities for family visitation, it has to be supervised, or has to check in on a child in their system. Do you have strong recommendations for those individuals that are now seeing maybe 20 families in a day in their homes because they can't come to a facility?
I can provide you the specifics. DCF is flowing down through the Department of Health into DCF, and so that they both get that information, understand what's expected, and how to do what they're need to do.
Right, but when hand sanitizer is a rare commodity these days, and finding a sanitized wipe that actually meets your standards is almost impossible, it seems like. How would you recommend those individuals protect themselves and the families they visit?
Well, the default is soap and water. that is by still the best option. So when you're in a facility, and just like us, and you got to do what, you got to use what you got. We hope of somebody giving us all of this stuff all of a sudden is not realistic. I think the communities are doing everything they can. If there are people that sometimes we see aren't practicing, you know, we had a policy of see something, say something. I don't know if that's going to get to that point. Between the employers, private sectors, and the government through the services that you're talking about, everybody is trying to get both everything they can to know what to do and as much as is available what they need to do it. That's, you know, and I know right now hospitals, if they can't get some of these PPEs, we know that's a problem. And the governor through the country has asked for tremendous amounts, and they haven't come in the quantities that we all would need and hope to see.
Dr. Holt?
Okay, just one follow-up.
Well, we've gone too much here in the question with Dr. Holt. We still have other presentations to go. Okay? So this is your last quick question.
How many manufacturers of those materials have actually given you a lead time on the testing kits that we need for the state of Florida?
I'm not in that, I do not work with the manufacturers. The way the kits are, the testing is through the commercial, the private sector, so Quest and LabCorp. And I get varying reports. Community physicians, some have what they need and others don't. So and the large quantities that we would need for an open testing are certainly not available. But this is all coming from the federal government, who's giving it to the state, who's going to give it to us, rather than me trying to work through the manufacturer, which would have to be a middleman, I'm sure, the suppliers. I'm not in the business of that. I just do the public health protection that I'm responsible for.
Thank you,
All
sir.
right, Vice Mayor Ross?
Thank you,
Nice.
Commissioner. Dr. Holt, just a quick question, then I know we have to move on. But of the new cases in Hillsborough County, have you been able to establish how these new victims were infected? Is it family member to family member or
No.
travel related? Or
The predominance of our identification have been through travel, even in the commercial, or some risk factor. They may have been in contact with someone out of the state, but not here. The more we test, because our restrictions are inherently looking for that, that's what you're going to find. So, you know, I don't want to tell you that what we have found is really represents what's going on. And if I don't want to leave that misperception.
very good, thank you.
Vice Chair Quan?
Yes, sir. Thank you for the presentation. One of the things I'd like to make sure is there a pre-screening process, since we're going to be opening up these facilities, is there a pre-screening process that we can make available to the public that says, just like the one we filled out before we came into this room today, if no, then you don't need to get in line to get checked? So
Yeah.
because of the limited
Right.
resources, I think we should, as a group, come up with a pre-screening that someone takes prior to go standing in line for a test.
I think what will be appreciated is that there's a remarkable public-private partnership led by the hospitals, Dr. Anand and Baycare pulling together, and this is going to be regional. The lack of equipment supplies is a critical stop. But as you've seen in some of the hospitals, Baycare in particular, was able to do 500 or something in a day. You know, that's the beginning of the scale that we would hope to achieve.
Are we tracking negative results as well? Negative
You
tests?
mean how many are done negative?
Yeah, so if we gave
Sure.
out 500 tests, how many of those tests are negative?
Great question. I can get directly the information from the state on our test. We've already reached out and we're getting a lot of cooperation from the hospitals that are running their internal test. Getting the ones that are sent to Quest and LabCorp are harder because I've got to work with the physicians and others because, LabCorp doesn't necessarily have that data readily available. But I would love to have that. You're spot on. That's what we need.
Dr. Holt, thank you very much, sir. I know you've been very, very busy and probably got a lot of sleep this night. We appreciate all that you've done. Thank you so very much. Chief Jones.
Good afternoon, Dennis Jones, Hillsborough County Fire Rescue, and representing Hillsborough County Division of Emergency Management. We continue to work closely with the Department of Health, and the EOC is currently at a level 2 partial virtual activation. We've been at that level since March the 10th. What that means is we have some on-site and some virtual positions being staffed. And the reason we're doing that is to support social distancing and decrease the likelihood of infection. Our primary objectives are to continue to assist the Department of Health in the containment and prevention of COVID-19, ensuring adequate availability of priority supplies, and that continues to be a challenge, as you've already heard. We're coordinating with our partners to implement and adapt action plans. And our goal is to send out accurate and timely information to decision makers such as yourself and stakeholders. The Department of Health and the Office of Emergency Management are engaged with our partners. We're hosting regular meetings, and we're trying to create preparedness activities that are coordinated proactively to address the outbreak. Our current actions at the EOC, we have established a unified command. We have emergency management and Department of Health working groups that are preparing for provision of vital services to our community. We are continuing to monitor the spread of the disease through Hillsborough County. We have established a joint information center that was established on March 3rd of this year. They have created a cloud-based hub to share resources with our partners and PIOs within the various organizations. Twice weekly, we're putting out situation reports. Those are released on Tuesday and Friday. We are placing resource requests for personal protection equipment, PPE, and critical medical supplies through the Florida Division of Emergency Management. We are also conducting and participating in weekly, regional, and daily state conference calls. We're exploring facilities that should the need arise, we would have space for isolation or quarantine of members. We're preparing the former Mosey facility as a warehouse and logistics facility for healthcare supplies that we're ordering. Fire Rescue continues to support the emergency operation, and we also have, thanks to Mr. Merrill, he's released funds to purchase self-contained breathing apparatus and masks that we can adapt for this particular situation. The Department of Health is continuing to partner with us. We are establishing testing locations, collection locations, as has been mentioned. There's a walkthrough this afternoon at Raymond James at 3 p.m., and there's also a walkthrough tomorrow at the Florida State Fairgrounds to develop these collection sites as soon as the collection materials and PPEs are available. The Department of Health continues to give guidance and education to all their partners and monitors the spread of the disease. Economic development through Hillsborough County is working with the Small Business Administration, low-interest loans, coordinating internal and external stakeholders. The procurement services is the county is ordering supplies with a concentration on supervisor of elections, aging services, Head Start and children's services, and transportation. Our facilities within Hillsborough County have increased their cleaning efforts. 165 facilities are being sanitized after hours, and 109 of our first priority buildings are being cleaned twice a day 39 additional buildings 1 time a day, and this facility is being cleaned 3 times a day and then a deep cleaning after each meeting such as this. Human Services is doing their appointments virtually. They're doing telephonic interviews. The community centers, the resource centers, they're putting up signage so that the citizens know that they can do these things virtually. And they have a call center that continues to monitor, and they continue to work with TICO to hopefully prevent people's power from being turned off. Human Services also is working with communications to share the message, and working with the Tampa Hillsborough Homeless Initiative, and taking steps to protect the homeless population against the spread of COVID-19. Our next steps are to continue to monitor COVID-19, continue to work with our partners, and continue to provide accurate and timely information to the decisions and stakeholders. Any questions?
Any questions, Chief Jones? Any questions, Chief Jones? Thank you, sir.
Thank you.
Mr. Waggoner.
Good afternoon. My name is Brandon Waggoner. I'm the Chief Administrator for Government Relations and Strategic Services, and I'm here to provide you a brief overview of the federal and state legislative actions related to coronavirus. In addition to President Trump's national emergency declaration of March 13th, the federal government has so far passed 2 pieces of legislation in response to the virus, and a 3rd bill is already in the works, and I'll briefly touch on those. The first bill was the Coronavirus Preparedness and Response Supplemental Appropriations Act that was passed on March 6th. It provided $8 billion in the following way: $1 billion for state and local preparedness grants to go to cities, states, and tribes within 30 days. Each state will receive no less than $4 million. $100 million for community health centers, $10 million for worker-based prevention training to prevent and reduce exposure for hospital employees, first responders, and workers on front lines, and $20 million to the Small Business Administration related to increased loan volumes to help businesses affected by the outbreak. The second bill was authorized just last night. It is the Families First Coronavirus Response Act. It's an $800 billion package that was passed by the U.S. Senate yesterday and signed into law by the President. In general summary, it includes expanded paid leave, food assistance, and unemployment insurance, along with increased Medicaid funding to states. It provides tax credits to employers to offset the costs of providing emergency paid leave, and it requires insurers, Medicare, Medicaid, and other federal health programs to fully cover testing and related services for the virus. And the bill also provides emergency funding for several nutritional and health programs, including WIC. More specifically, under the areas of nutrition, the measure provides $250 million for health and human services programs that aid the elderly, $160 million for home-delivered nutrition services, $80 million for congregate nutrition services such as adult daycare centers and meal sites. In the area of Medicaid funding for test coverage, states can cover tests for uninsured people through their Medicaid programs and receive a 100% FMAP to cover the cost. Medicare currently covers testing without any patient cost sharing. Insurers, private insurers, would be required to cover coronavirus tests and related services without cost sharing and without prior authorization required. In the area of nutrition assistance, the measure is providing $500 million for WIC, $400 million for the Emergency Food Assistance Program, $100 million of which can be used to offset costs related to distribution of those goods. Under SNAP, specifically for kids, the bill allows states to adjust their SNAP programs to provide additional aid to households with children eligible for free or reduced school meals if their schools are closed for more than 5 days. For work requirements, SNAP is allowed to temporarily waive federal work requirements for eligibility. And under general benefits, states are permitted to request emergency allotments of food aid to support increased participation in SNAP and address temporary food needs. Moving into emergency leave. Under family leave, private sector employers with fewer than 500 workers and government entities would have to provide as many as 12 weeks of job-protected leave under FMLA for employees who are unable to work or telework because they have to care for a child younger than 18 whose school or daycare is closed because of the virus. Leave assistance would be capped at $200 per day or $10,000 total. For emergency sick leave, private sector employers with fewer than 500 workers and government entities would have to provide employees who are unable to work or telework with immediate paid sick time off in order to comply with federal, state, or local quarantines or isolations, to self-quarantine on a healthcare provider's advice, obtain a medical diagnosis for coronavirus, or care for an individual who is in quarantine or for a child whose school has closed. Full-time employees would receive 80 hours of sick leave under the new emergency plan, and part-time workers would be granted time off equivalent to their scheduled or normal work hours in a 2-week period. That leave assistance would be capped at $5,110 for a worker's quarantine, or at $2,000 to provide for care for an individual or a child. An employer cannot require a worker to use any other available paid leave before using the sick time. Another provision under employer tax credits, it provides refundable tax credits to employers to cover paid wages paid to employees while out under this program. However, governments cannot access that credit. Next, under emergency transfers, the bill provides as much as $1 billion for emergency transfers to states to process and pay unemployment benefits. And each state will receive a proportional amount based on the share of unemployment taxes paid. In general, the bill provides $82 million to the Defense Department for their health plan, $60 million to Department of Veterans Affairs, $15 million to the Internal Revenue Service to carry out the provisions of the bill. Additionally, as of last night, HUD will be halting foreclosures and evictions for families with FHA insured mortgages, and the Department of Labor has announced up to $100 million in dislocated worker grants. As I mentioned at the outset, these are the first 2 bills that have been implemented. A third bill is already in process. Estimates are that it could approach $1 trillion. Amongst the provisions we're expecting to see are additional treatment for unemployment insurance, increased Medicaid funding, and further assistance to small businesses. At the state level, the governor is signing, or excuse me, the legislature is approving their state budget today. In fact, it's on TV there. Set aside in that budget is $300 million for coronavirus issues. I would expect that they'll be back in special session in the near future to address the state budget as we see the impacts from this virus. And Florida Department of Emergency Management is ordering additional supplies, as Chief Jones has indicated. In closing, I just want to recognize our state and federal partners, in addition to you, for all the work that's being done quickly. Things at the state and federal level usually move pretty slow. The fact that 2 bills have been authorized within a 3-week span is remarkable. So it's a testament to our state and federal partners that they've stepped up. They're doing the very best they can under a stressful situation and trying to create appropriations and policies that encompass a whole variety of issues. We will continue to stay in touch with our partners to forward our desires and needs, and I'm happy to answer any questions you may have.
Any questions, Mr. Waggoner? Any questions? Commissioner Merrill, you recognize.
Thank you, Brandon. Thank you for the report. 2 things. SBA had a great announcement. They were doing the phone conference call to help small businesses with the loan program, but it was a very limited access. So if you could relay to our federal advocacy team, actually it was a disaster. So many people tried to get on that needed help. And I can imagine, nationwide, what the issue is. I think they only had the capacity of maybe 450 people to get on. So we really need more access. And these small businesses, in our community, about 83% of our businesses are small businesses, and that's 10 or fewer employees. And they need help, they need assistance. Second point is, I think the money that they're giving us is great, but if it is going to take 6 to 9 months to get here, and if it has to flow through a bureaucratic mess to get here, for instance, if it has to go through the Department of Labor, if it has to go through our own Department of Economic Opportunity to get to career source centers, I think we're fooling ourselves to think that there's going to be a lot of help immediately. These people are without jobs now. And we have seen an increase. We had our board meeting today, the increase in requests for SNAP. We've had to our call center, fourfold increase in the number of calls each day starting this last Monday. So it's hitting, and it's hitting fast. And I hope that we can relay to our federal partners that we need assistance here at the local level, and that doesn't need to flow through the bureaucracy. We need it here and now. Thank you.
Anyone else? Thank you, Mr. Wagner.
Thank you.
Who's going to address the closure restrictions, specimen collection initiatives? Someone going to do that? Mr. Merrill, you want to address those?
Yes, so I think I already mentioned at the outset, my recommendation to reduce the restriction from 50 down to 10 individuals in groups. We have already heard about the specimen collection initiative from Chief Jones and from Dr. Holt. Dr. Holt also described the alternate care sites, and that's something that we are working on through the emergency management with our partners, looking at both available hotels for sale and we've identified a couple of them, working with those owners, and offers from the private sector that have been coming in to make their facilities available that could be used to place people in a sufficiently quarantined area that's safe. So those are being prepared now, or working towards preparing them in the event that, as Dr. Holt said, the hospitals, ALFs are at a point where they just can't handle the need. So I think we have covered everything.
Okay, so at this point, I think we need to get into the discussion of your recommendations and take a vote on those before we bring Mr. Johnson up. Am I correct?
Yes.
You want to start with your first one? Ms. Merrill? Start with your first one?
I'm sorry?
Want to start with your first recommendation?
Or you can just have discussion first among members. It's up to you how you want to proceed. We can take the first one if you like, the 9 to 5 curfew.
9 to 5. So any discussion on the 9 to 5 curfew that's being offered?
Yes.
Mayor?
I disagree with that. I think that that's going to come at a point, but right now, I don't see the value of it, and it would be an imposition to law enforcement to put that on their plate right now. I don't know what we're going to serve with a curfew at this point. I think it will come down the road, but I think there are a lot of other things that we need to do prior to a curfew.
Commissioner Overman?
I think clarity is important. If we have a 9 to 5 curfew, with the exception of work, in other words, if you're out and about because you have to work, you have to get to work, you have to get to the grocery store because you've been working, 18-hour shifts or whatever, if you're on a purpose to help your employment to take care of your family, that should be a permissible exception. Or if you're a healthcare provider, first responder, any of those items. But what we're trying to do is reduce the amount of community spread, I think, with these hours. Can we get some clarity on what we all agree on if, in fact, the 9 p.m. to 5 a.m., was that the hour? Curfew is going to be something that should be recommended and implemented.
Chef Cronister, you recognize.
Yes, Mr. Chair, I appreciate it. I'm the one that had brought forward with the county administrator the option of having a curfew, and certainly the language is critical in how this is drafted. This would most certainly be to break the cycle of community spread. We as a group would have the comfort knowing that 8 hours out of a day, 1/3 of the day, we would be strongly encouraging individuals to quarantine and be home with their families versus out. We're certainly not looking as law enforcement to go out and arrest everyone who breaks curfew. This would allow a mechanism for law enforcement to approach a group of juveniles who we've seen a group of activity spike because they believe virtual school means no school and they're out and about. This gives us a mechanism to approach them, call their parents, and try to return them home and encourage that they are quarantined at home. Same will be applicable to adults, especially if we move forward with limiting restaurants or eateries to takeout. You know, we would want these adults to be home. Again, I think that this is the only way we're going to break this cycle, the cycle of spreading the virus. Again, if we do pass this, I would respectfully request permission to work with the county attorney to provide input with the language. Again, to make sure, again, it's critical, the exceptions, if you're working, if you're going out to get food, whatever this group decides, to put those policies and procedures in place it will be critical in the language. Again, I've talked to the municipal chiefs. They're in support of this. They also had some concerns as well. We wanted to make sure this wasn't a curfew per se where we were establishing police checkpoints and stopping every car. That certainly wouldn't be the intent of the curfew at this point. It would be simply to break the cycle of the spread of the virus. And this would allow an infrastructure in place that we could restrict as and if the coronavirus continues to spread and this group elects to do so.
Vice Mayor Ross,
No, Commissioner, I pass. Thank you.
Mayor Lott.
Yes, please. Thank you, Mr. Chairman. I've heard three colleagues' comments here, and I think there's points in all three, you know. I have to say, though, I 100% agree. At this point in time, with the stage we're at, I agree with the mayor that I think that our citizens right now are looking for us to bring calm, resolute resolutions that we're doing, okay? And I also think that it is wise for us to also stay in step with the state of Florida and our governor, and so that there's no confusion when you go from county to county, city to city. What are the policies? There's already a lot of confusion out right there. I think since Tuesday, a lot of that confusion has worked its way out. And to add a curfew right now, I'm afraid that that we're going to add a lot of hysteria into Hillsborough County. I do agree with the sheriff that if that day comes, I think we should start crafting that language now. There's a lot of entities that we need to decide on. For instance, if you look, I know we're talking about the workforce and so forth, but if you look at County Line Road, for instance, there's 17,000 people work between 11 and 4 in the morning delivering goods to Winn-Dixie's, Publix, Gordon Foods and so forth, that's trying to get those products out to the stores by the next morning. And there's a lot of industries out there that we need to make sure that we take the time to recognize Tampa Electric, electrical workers, emergency workers, AC technicians, whatever those may be. I think we should take our time and really put forth that language together, like the sheriff suggests, so that when we get to that day, we have something that all of us feel comfortable with. But to do that today, I would vote no for that. Thank you.
Commissioner Merrill, when you recognize.
Thank you, Mr. Chair, and thank everybody for the comments. I've listened to both sides here, and I do think 9 p.m. is too early. I think it should, if we were going to go to a curfew today, it should be 10 p.m. to 5 a.m. I think that there's still a lot of people that work till 9, you know, just getting home and doing all that, picking up kids from somewhere. I mean, I just think it could be problematic. And if we were to establish a curfew, I'm on the side of exempting the drive-throughs, like all the fast food chains. People get off work at 9, 10 o'clock, whatever, that need to eat, and the grocery stores are closed at 8 o'clock. I think we've got to, I mean, it's, the prudent thing is to tell everybody, please just stay home until we get past the worst part of this. But on the other hand, we have to be realistic about what their needs are right now. And people realistically are not seeing a huge epidemic yet, though I keep telling them the numbers are increasing and they will increase. But I do, maybe it's just a few days, or maybe next week I would probably definitely approve a curfew. I don't know if today I think we should get prepared for it. I think we should tell our community to get prepared for it because a curfew is coming. And so that everybody can spend this time now in the next few days preparing for it. But I also do think the drive-through restaurants should be able to operate to allow people access to food.
Let me offer a suggestion and see if we have a confirmation of what we can do here. I would suggest that Mr. Merrill and probably the mayors and their designees and Sheriff Cronister start working on with their lawyers to, if we have to next week, I understand we're going to probably have another meeting next week, that if we have to put this curfew in place, we have something already in place to do that. Is there any objection to that? Any objection? Mr. Merrill?
Mr. Chairman.
Yes, sir.
I appreciate your leadership, and I agree with the suggestion you're making here. I really hope that, every time we make a decision, there's the unknown consequences, okay? And I think each one of us can, speak personally about some of the already unknown consequences that we have, that our friends, family members, and our community has already suffered from it. I was just listening to County Commissioner Overman here, and we're talking about caregivers and so forth. Yesterday, I took my father home at 7 p.m., and we were looking for help during the evening and so forth. We had to call multiple agencies because they're having a hard time finding caregivers to work the night shifts because they're believing that there's going to be a curfew, and they're not going to be able to. They don't want to get caught driving to someone's home to do night shift work. So I'm not bringing that as just one case. I'm just saying there's a domino effect in every decision we make. I really hope we put, and I know that your suggestion here, I really encourage us to put a lot of time and attention to everyone so that, people at risk aren't put at risk. So I'm looking forward to seeing this legislation come back.
Well, Mayor, that's why I said that we have Mr. Merrill get with all three mayors and the Sheriff Cronister, and you all can get with your law enforcement heads and put heads together that if we have to put forth a curfew, that it comes out in a reasonable way, that those needs that you just talked about and others are talking about, that don't feel that we're neglecting them or trying to put restraints on them. And I can tell you one of the other things going to come forth is that you're going to have people saying you're hurting certain people in our community, and that's not what we want to have happen. And this is all about trying to put a lid on the possible spread of this virus. So that's why I said, when Mr. Merrill will get with everyone that we just named and work this out. If we have to bring it back next week, at least we have something on the table that we can all agree on. Okay? All right. Mr. Merrill, Overman, you recognize.
Thank you. And I think it's important for us to actually define when and if we go that way. We are going to see an increase in numbers because we are going to see an increase in testing capacity. So we're going to get to a place where, maybe 5 times the number of confirmed cases are suddenly now being all over the news, and people are going to start getting upset and getting worried and getting scared. It doesn't mean it's not out there. It's just we haven't been able to do the test. So we need to set a benchmark, or at least an understanding of the decision-making process that we would go through if a curfew were something we would actually approve in the future. More importantly, the message is to avoid curfews means all of us have to be and follow the CDC guidance. Every single person on the face of the earth must do that, and especially in our area where we have vulnerable citizens. So I think in the deliberations for the decision makers that are being sort of identified to go through this process, that needs to be thought through so we have an understanding of when that would be implemented and why, so that people understand.
That's why I said, Commissioner Overman, Mr. Merrill, who we give the authority to by this body and through statute, that he would lead by getting the mayors, Sheriff Cronister, and the mayors that they want to bring in their law enforcement folks. We'll have at least almost a week to work on this so we can iron out any differences, any decisions that we feel that be difficult to implement, and if we even have to do it. We may get to the point next week we don't have to do that. That's why I said bring those folks together, okay? Any objection to that? Thank you. Mr. Merrill, the restaurant to delivery 24 hours.
Yes, the order that's currently in force is the one that takes the governor's action earlier this week and combines it with the order that I issued earlier in the week, which limits the occupancy to 50% of the capacity in the restaurant and requires them to close by 10 p.m. So for your consideration, it would be a closure of restaurants except for delivery and for pickup, and they would be open 24 hours.
What's discussion on that? Any discussion on that? Commissioner Merrill, you recognized.
Thank you, Mr. Chair. Does that include the drive-throughs?
Uber drivers?
Yes.
Lyft drivers?
Drive, it does.
Yeah,
Okay, thank you.
any kind of, anything that doesn't involve people sitting in a restaurant getting served, let's put it that way, just easier.
Commissioner
By
Overman, you
mule,
recognized.
by
Hold up.
whatever you can do. So,
Commissioner Overman, you recognized.
Okay, I appreciate the idea of takeout only, and only available and being available for 24 hours. Although a lot of our restaurants also have dining rooms, and so if we eliminate dining room service, there are certain licenses that don't allow for packaged delivery of beverages, and they're going to need some guidance on how they are going to handle this. If they don't have the ability to package alcohol, but that's part of the dinner order or things like that, believe it or not, I've gotten a lot of emails from our restaurant owners that also serve alcohol that say, okay, I can keep open till 10 or higher as long as I only had 50 or 10 people or 50%. What do we tell the restaurant owner that now knows that they have to close their doors to dining room service and are willing to do the takeout? Are they allowed to distribute whatever they sell in their restaurant?
Are they allowed to?
Sell whatever it is they have in their restaurant?
Got a legal beagle back there?
It's a different.
Paul Johnston with County Attorney's Office. I believe their state licenses prohibit them from providing off-site consumption, so that would be prohibited. This is something the state would have to relax.
Okay, so I'm not that I'm suggesting we do, but it needs to be clear what they're allowed to take out of their restaurants and if they're able to acquire takeout service for their.
Yes, we'll make it clear it's non-alcoholic beverages.
Okay, thank you.
Any other discussion? Mayor Lott?
Mr. Chairman, so in the last 2 days, I've spent time going out in the community, visiting different establishments, so forth, our restaurants and everything. And first, I want to applaud the community effort to abide by the ordinances we have passed on Tuesday, or that the city county administrator approved on Tuesday. In every restaurant I went to, every other table was marked off, a sign on top of it, not serving this table. No one was allowed to congregate in the lobby. Everyone had to wait outside before they could come inside. Before someone was set at a table, there was an employee that was disinfecting the seating, the tabletop. Everything was being served with plastic utensils and styrofoam cups. And I will tell you, I don't think I've ever felt so clean in a restaurant ever, you know. And so I had the opportunity to, you know, speak to the winners and the losers. The winners in this particular case with what we've done so far are those restaurants that are primarily takeout. Your pizza establishments, your chicken delivery locations, and those that already derive a majority of the revenue from takeout and delivery versus inside dining, you know. So this ordinance is probably not going to affect them much at all, okay? But those establishments that only get, you know, a small percentage of their takeout delivery, each and every one of them said if we did anything to limit the inside dining any less than where it's at right now, they would just go ahead and shut their doors, okay? And again, maybe that's where we have to go, but are we there today? You know, are we willing to make a decision today to shut down every restaurant? And it's not just for the sake of those restaurants, but we have a lot of people, citizens, elderly and so forth, and I think those restaurants are moving in that direction. Today, when I was in one restaurant, there was 2 people inside. There was from Bike Squad, okay? And both of them were previous waitresses, were laid off, and they went to working for Bike Squad. I think that's probably where we're going, is a complete, elimination. But I think we need to allow those restaurants to converge. They need the proper supplies on hand so they can do takeout and delivery and so forth. I hope we delay this one more week and just give those restaurants a chance to get their resources in place, their supplies in place, and be able to get a number of people as they really allocate to jobs so they have the ability to stay open, but work towards a takeout and delivery type model. But I can tell you, they're not prepared today. They've only had 2 days to get there, and that's just not enough time,
Vice Mayor Ross, you recognize.
Yes, I'd like to kind of agree with Mayor Lott on this. I've been in touch with a lot of our local restaurants, and they are currently preparing for this eventuality. I think they all know that this is a possibility, but they're not ready yet. And we just imposed restrictions that, by and large, I don't think we've had anybody not voluntarily comply. I would like to give them a week, too. I would like to recommend that we postpone this decision for a week and see where we are.
So, did I see your hand, Conor?
Yes.
You recognize.
Thank you, Mr. Chair. I agree with the mayor and the vice mayor. Especially, we have so many of our public and private partners who are helping feed the children in our community as well during this time with special deals. We've already put the restriction, 50% capacity. I think making this decision now, I think we give it another week. Those restrictions are already in place. They're working, I believe. So if we could give it another week, I would vote for that.
Okay. I can count votes. Mr. Johnson. And Mr. Merrill. Is there a possibility that we could work on some language that when you come back next Thursday, if we have to implement this closure and only have deliveries, pickup and deliveries 24 hours, could you have something in place by that time?
Absolutely. The current county administrator order is in effect now. We can leave that in effect for the next week.
Is that okay, Mr. Merrill? Okay. All right. Lastly, dropping the gatherings from 50 to 10. From 50 to 10. Any discussion? Any discussion? Any discussion? I have a motion to adopt that. Motion by Commissioner Merman, second by Mayor Lott, that we drop the gathering in Hillsborough County from 50 persons to 10 persons. Any further discussion? Any further discussion? Seeing none, all those in favor, let me know by saying aye.
Aye.
Opposers? Motion's adopted. Any other discussion? I'm sorry, Mayor? Mayor, that's all you had.
I'm going to read something here. On March 12, 2020, this county emergency policy group delegated to the county administrator the EPG's emergency powers and decision-making with respect to COVID-19. While this has been done previously for short-term emergencies such as hurricanes, what we're facing now with COVID-19 is a national emergency with widespread effects and ramifications that are unknown and unprecedented. This will hit all 50 states, every county, and every city. For example, when more positive tests are reported in the county, additional protective actions will be required and efforts of more than one person will be needed to address the various issues. This group, in my opinion, should reconsider from an accountability, transparency, and equity standpoint whether in these unique and uncharted times it is a responsible and wise governmental policy to delegate the EPG's extraordinary powers to one individual who is not an elected official and is not required to act in the sunshine. I'm not suggesting that this group's emergency powers be delegated to any one person in particular. Instead, I would like the EPG to discuss and consider for this unique COVID-19 emergency whether we should delegate our emergency decision-making authority to a smaller working group of the EPG. For example, a 3-person decision-making group of elected officials that meets daily or as needed. I think it should be known that neither the state statute nor county code gives or delegates to the county administrator unrestricted emergency power and authority. Instead, it's up to this group to determine how our emergency powers are to be delegated and how they are to be exercised. In the meantime, the city, under the authority of city code as recognized by state statute, has the power to act as necessary in this emergency, provided the city coordinates with, is consistent with, and is subject to the county's emergency management plan. I acknowledge that the city cannot do anything inconsistent with the county's emergency orders, but if the county does not have an emergency order that addresses a particular situation, event, or emergency inside the city, then I intend to act under my emergency powers to protect the interests and the citizens of our city. Again, I would ask that the EPG discuss and consider for this unique COVID-19 emergency whether we should delegate our emergency decision-making authority to a smaller group of this EPG.
Mr. Johnson, you want to address that, sir?
Commissioners, and mayors, and sheriff, and school board chair. The authority for that goes to the county administrator is set out in our ordinance. The state statute authorizes the local jurisdictions, which would be the county board of county commissioners, to take action. The board of county commissioners in the ordinance has established the emergency policy group and delegated their authority to the emergency policy group. Once a emergency is declared under our emergency management plan, the county emergency management plan, all the authority of the emergency policy group is delegated to the county administrator.
By the emergency policy group, correct?
It's in the emergency management plan itself.
But the emergency policy group delegates that authority.
No, this is the plan adopted by the county board of county commissioners.
Did we not vote the last time to provide?
It is in the executive order also, yes.
So the emergency management plan that's adopted by the county commissioners gives the authority of the emergency policy group that the county administrator would have the authority to set forth all of the issues that we have to face at this point in time. And that's what we did on March the 12th, am I correct? Whatever that date was.
That's correct. And Commissioner, to be honest with you, the mayor's completely right. These plans and these ordinances were established because of disasters and hurricanes and stuff coming and action was going to have to be taken very quickly. That's why it was delegated to the county administrator. The county administrator is head of emergency management during the course of an emergency.
Let me ask you, Mayor, what is it that Mr. Merrill, on the direction and given the authority of this emergency policy group, not doing that you have some concerns with?
I'm not concerned with Mr. Merrill, and I think that I've worked very well with him. We have an excellent relationship. I'm just saying that this emergency is bigger than one individual, and I don't think that we should vest all of our decision-making power in one individual, for starters, that does not report to the citizens of Hillsborough County, the citizens of Tampa, Plant City, or Temple Terrace.
Mr. Johnson, let me ask you this.
Mr. Chairman?
Hold on. Can it be whereas, let me hear from Mayor Lott.
I'll let you finish your
No,
statement.
go ahead. I want to hear from you. You're a mayor, I want to hear from you.
Okay. I been mayor for a long time, and it's nice when you have the opportunity to be able to make decisions in your area that, because you know your community and you know the solution and you have the resources to be able to fix it, okay? I think that witnessing several hurricanes and other floodings and disasters over the years and working with this EPG, that when in the beginning I questioned the structure of it, that we have that authority in one person like that, but it really doesn't, because that person is working with all the agencies, with all the affiliations, and he has the ability, or she has the ability, to make a decision on the spot. And I think that timing is the essence, and it works. It's proven to work. It's worked very well. And I respect what the mayor's viewpoint and so forth, but I really believe that, and you say it often, Mr. Chairman, we have to be one voice. To have one voice, we have to set policy and have the county administrator, that is the only person in this room other than the sheriff that represents everybody in this county, to be able to fulfill that policy. So I would prefer for us to stay with the structure that is proven to work in this county many times, and leave it at that. Thank you.
Commissioner Overman, you're recognized.
And I do understand all the comments so far, but right now, our Emergency Policy Committee meets every 7 days.
That's correct.
So what I'm hearing is that there may need to be more frequency to accomplish the goal without taking the structure apart. Is that a compromise that might work, given the fact that we do have a different kind of emergency here? You know, a pandemic is not something that happens obviously every day. Hurricanes are something that we've gotten better at learning with, and we also know that they're coming for about 2 weeks, and then we deal with them. And then we deal with the fallout. With something like this, which we've not experienced before, frequency may help allow the policy committee to provide guidance for the administrator to implement with all of the emergency management personnel, because it's significant. When you go through the report, you can see there are hundreds of people that are talking to each other every day about what needs to be done, what's the next step, and how to get it done. I'm impressed with all of the people from both the city, the county, HART, all of the agencies are talking to each other every single day. So if we're able to possibly meet more frequently than once a week, given the urgent need that we have to protect our citizens, would that be a compromise that we might consider without taking apart the whole plan?
You referring to meeting more than every 7 days? Yes. It's just a matter of getting the entire group together. And when I say Hillsborough County is kind of unique, I think Pinellas has done something similar recently, but I believe every other county in the state leaves the decision to declare an emergency either to the Board of County Commissioners or to the county administrator. So Hillsborough County is unique in that aspect. It was just suggested to me a couple of minutes ago that we can research this a little bit more and come back next week and probably clarify it some, or what this group can do.
Mr. Merrill, you recognize.
Thank you, Mr. Chair. We are not limited to meeting every 7 days. I think we just did that for the purposes of the agreement. But when we've gone through hurricanes, we've met sometimes every day.
Right.
The policy group can meet whenever is needed to be convened. So we are not restricted to 7 days. We have to approve the extension of the agreement every 7 days.
That's correct.
But that doesn't say in itself that that's the only time we can meet. We just have to authorize that agreement every 7 days, and we can meet every day up till that point if we want.
Mr. Johnson, it appears that Mayor Castor's, one of her concerns is that even though the county commission puts the emergency policy, the emergency plan in place, that then authorized to give that power to the policy group to ask the county administrator, that the county administrator is not an elected person, doesn't ask for the public. What if the county administrator worked with the chairman of the county commission that oversees the county commission that put that in place, and he works with the county commissioner chairman who represents 1.5 million people?
You could, actually, that would take a amendment to the ordinance, the county ordinance, but yes, it could
So
be done.
we have to have the county ordinance amended.
Yes,
To do that, okay? So the county ordinance right now basically says that it's with the county administrator.
Yes, sir.
Okay. Any other discussions? Any other discussions? It appears that it stays as it is. Thank you, sir.
Thank you.
I thought he was going to review it and come back next week.
We can do
No,
that for
we
you.
never said that.
You asked him to.
No, I didn't. I didn't ask him to review this at all. We went right into discussion after you made your statement. We asked him to come back with the 24 hours of closing restaurants and delivery for 24 hours. We asked him to come back with the curfew if we needed. We never discussed, we passed a 10-person gathering. We never discussed your comments after you made. I never asked, we never gave direction to him to do anything on that.
Did he not ask you to come back about that next week?
That was the suggestion that was just made to me.
Okay.
Okay,
That's
whatever
all
the
right.
board directs.
That's all right. No, I don't want to put you in a bad spot. But, so the discussion, just because there's not a motion, is that why we've ended it?
Well, we didn't have a motion from anyone to discuss this. I mean, you brought it forth. There's no motion made to do anything any different.
Okay, well, then I'll make a motion that we meet as a policy group every day.
Is there a second? Is there a second? Is there a second? Guys, for
I will second for the sake of discussion, because I'm not necessarily every day. I think every other day or every third day might be a little more appropriate, but I don't think, unless the statistics, see, I think facts drive decisions. And so if we're going to base on facts, then I don't think we need to meet every day yet. Not saying that we may not need to very shortly in the near future. But I'd be more comfortable, I'd wait to hear discussion on maybe every other day or every third day.
Commissioner Oman to the motion.
Okay, to the motion. So let's talk about logistics. If we meet more frequently, who makes the decision to hold the meeting? Because I think if we can identify what the need is, so which policy member can raise the hand and say, hi, I've got an urgent issue, let's get the policy committee together. Does the administrator make that decision, or does the chair of the Florida County Commission make the decision? I think it's helpful to make some clarity here, and then we can probably address the concerns. Daily is going to be a burden, especially those that have family to care for, but not impossible. But it is going to also mean all these folks in this room are here listening to us instead of doing their job.
Mr. Johnson, you want to address that, sir?
I can only tell you in regards to that traditionally it's the county administrator that asks the group to meet.
Exactly. Any other discussion? Vice Mayor Ross, you recognize.
Yes, I'll certainly meet every day or every third day or every other day or all day if that's what's necessary, but I think that decision should be fact-driven. And up until this point, we haven't heard anything from Dr. Holt or from Mr. Merrill or for anybody who's indicated anything that would lead us to need to meet more frequently. If that becomes necessary, certainly we should meet every day or however often we need to meet. But right now, at least from Temple Terrace perspective, things seem to be working well. I think Mr. Merrill is communicating very well with us anyway, and I feel like he's representing the interests of not only unincorporated Hillsborough County, but I think he's certainly representing the best interests of our citizens in our city also. So I'm not opposed to meeting more frequently. I'll certainly do whatever is required to meet the crisis. I haven't heard anything today that has led me to conclude that there's a need for us to meet more frequently at this point.
Commissioner Merrill, you recognize.
Oh, wait, Mayor Castor had her
I'm sorry.
hand up first.
I don't want this to be interpreted that I have anything negative to say about Mike Merrill and the job that he's doing. My position is that we are going to be very shortly overrun. The only reason we don't have cases is because we're not testing. So this is going to turn into an emergency very quickly. And my position is that it's bigger than one person, and we should have those individuals that have been elected to represent the people making the decisions for our community. That's my position. It's not a criticism on Mr. Merrill. I feel that it needs to be with elected officials and a larger group, whether it's the entire emergency planning group or a group of 3, whatever it is.
Commissioner Merrill, you recognize?
Okay, Mayor, I agree with everything you just said, but I think for the time being, again, getting back to the comments, facts drive decisions, since I seconded her motion, can I make an amendment?
Yes.
I'm going to amend the motion for right now, for the next 7 days, that we meet every 3rd day. And then we will review that decision to meet more frequently after the next 7 days.
Is there a second to the amendment? There's an amendment and second by Commissioner Overwood. Any discussion on the amendment of meeting every 3rd day? That means that this passes, we meet again on Sunday. All right? Does that count right? Thursday, Friday, Saturday, Sunday. Sunday.
Can we set a consistency here, maybe a Tuesday and a Thursday, or versus every 3 days? I mean, I think that way if we have because every 3 days would be a rolling average, you'll never know. Has it been 3 days? Has it been 2 days, 4 days? Just like we know right now, every Thursday at 1:30 we meet. If we could set something that's more consistent. I also want to say something though here. I mean, I don't want the public to think that all we do is come in here and meet once every 7 days. All of our staffs, all of our police departments, our fire departments, they're working daily. Every day starts off with a morning meeting, coordinating with the sheriff's department, coordinating with the county, coordinating with the other municipalities in our community. And they're hard at work. And what we don't want to do is slow down the process, slow down progress. And right now, I think what we have is working until it proves that it's not working. But right now it's working, and I have all the confidence in the world, and I know we all have the confidence in the world that Mike Merrill will bring us together as we need to. I'll support two times a week or whatever what makes it everyone comfortable. But I just feel like right now our county administrator heard us, and as there's data, as the Vice Mayor of Temple Terrace said, and we need to come together more often. He'll bring us together, and I would hope we'd take that leadership right now. If it doesn't work, then let's put a set schedule in place later on. But right now, we have a proven track record. This agency is battle tested. It has worked before, and I would like for us to rely on it like we have in the past. But I support the feelings of this group.
Mr. Merrill, you want to?
Okay, bring this in for a landing. Okay, Merrill, great comments. I think hearing all the comments, I will withdraw my previous amendment and make a new amendment to meet on Mondays and Thursdays of every week. For the next week, and we will review that policy at our next meeting next Thursday to meet, if we need to meet for more frequently.
Is there a second to the amendment? I second that. Commissioner Overman seconds the amendment. So we have a motion amendment by Commissioner Merrill, second by Commissioner Overman, that between now and our next meeting on next Thursday, we meet Mondays and Thursdays at 1:30. Any questions on the amendment? Any questions on the amendment? Seeing none, all those in favor of the amendment, let him know by saying aye.
Aye.
Opposed likewise. Now on the amended motion by Commissioner Castor, second by Commissioner Merrill, any discussion on the main motion that's been amended? Seeing none, all those in favor, let know by saying aye. Aye. Opposed likewise. Motion is adopted. You want to talk about the local state of emergency extension, sir?
Yes, sir. Before you is a package that contains a proposed executive order extending the original executive order of March the 12th. It's basically just asking the board to do a few things because of the threat of the virus, is to extend the executive order of March the 12th for the next 7 days. Have all the provisions that were contained in the original order remain in effect and made a part of this order. Adopt and incorporate the county administrator orders that have been issued since the last time you met, and make them part of this order. Adopt and incorporate the latest Governor's Order 2068 into this order, and have this order take effect immediately upon adoption.
Okay, then that order would include the two things we just added, being the persons drop, the gathering drop, and the 10. Does that come into play with that order now, or that something that separately we have to work on?
That will be part of a county administrator's order, I believe. Yes,
Okay,
sir.
all right. So we need to vote on this, am I correct?
Yes, sir.
Is there a motion?
There is a motion to
Motion by
extend the emergency order for another 7 days.
Motion by Vice Mayor Ross, second by Commissioner Merrill. Any further discussion? Commissioner Overby, you recognize.
I know that we have very large families that tend to get all of their families together and work together. There may be more than 10. Is that considered a gathering, or is that considered a family?
Mr. Johnson?
That's beyond me.
Okay, I just want to make sure we're not harming large families
Yes.
that tend to be together when they're frightened, to cause them some concern about breaking the law.
That's something that perhaps could be addressed in the order, in the
Okay.
administrative order.
So that's, I just wanted to make sure that that was taken into consideration within the order. Otherwise, I'm fine with it.
Yes.
Any other discussion on the motion? Motion by Vice Mayor Ross, second by Commissioner Merrill. Seeing no further discussion, all those in favor, let me know by saying aye.
Aye.
Opposed, likewise. Motion is adopted. Mr. Merrill, anything else?
No, that concludes the business.
Seeing no further discussion, we adjourn.